The very piece of advice I will tell them is that they have to follow their dreams. Obesity sometimes can be a dream killer, but sometimes surgery is not the solution. Surgery will be part of the solution. I always tell my patients, I give you a tool. It depends what you are able to do with that tool, is how the good results you are going to obtain. It's very frequent the question, who qualifies for surgery? And the answer is very simple. Those that have more than 100 pounds in excess on their weight, or they have a certain BMI, that is body mass index, is a measure we do for the degree of obesity, taking into account not only the weight but also the height. Okay, it's not the same if you are that tall and that thin, or that short and that wide. So it's the two measurements, weight and height, are making a big impact on that. And basically you have to have a BMI more than 40 or more than 35 with some health problems, or diabetes, or high blood pressure, or high cholesterol, etc., etc. Most of the patients I see in my office, they are already decided to undergo surgery. So I had the opportunity to talk with them, and I really I realized that this is a very important opportunity for us to explain what is surgery about. Surgery is scare most of the people, just the word. But basically, this operation has a safety profile that is very similar nowadays to a removal of the gallbladder. That is very simple, very common. You will find in your family several family members that their gallbladder is gone after a laparoscopic operations, and they are fine, they didn't have any problem. Well, let me tell you that currently, if you search in the literature, you will find that the safety profile is very similar to this operation. Is the same complexity? No. It's a much more complex operation. Is the same patient? No. It's a much more complex patient. But certainly, nowadays we can perform this very complex operation through very small incisions with a safety profile that makes this operation safe and sure for the health of the patient. The process doesn't finish after you have the operation. You are just in the middle of the process. The process started before, when you started doing the preoperative weight loss with our outstanding weight management team here at MetroHealth. Then in the middle you had surgery. And after surgery it starts another process that will take you probably between a year to 2 years to lose all your excess weight. It doesn't happen from today to tomorrow. Your weight loss will be incredible, rapid after the operations. So I will say that 50% of what you are going to lose, half of what you are going to lose, is going to happen in the first 6-7 months. After that, you're going to decrease the speed of weight loss, but it still will continue up to 1 year, 2 years, depending on the patient, depending on the surgery, depending on your motivation and how you use your tool.